57-year-old man with severe pneumonia and hypoxemic respiratory failure. Background information. The patient was admitted to the ICU with previous symptoms of mild health, chills, fever of 39.2 degrees Celsius, and upper respiratory symptoms. A chest radiograph reportedly showed evidence of pneumonia in the left upper lung. Treatment with ceftriaxone, azithromycin, and an albuterol inhaler. Pneumonia is an inflammatory condition of the lung affecting primarily the alveoli. It is usually caused by infection with viruses, bacteria, or fungi, or both. It can occur and mixed infection.
Hi, I'm Erica Shepard and I'm a CVS pharmacist. Each day, 3,000 gallons of air containing all different types of bacteria, viruses, fungi, and other germs move through the lungs. Because of this, the body goes to great lengths to protect the lungs, but some germs still manage to get through. Once inside the lungs, certain germs can multiply and trigger an immune system response that damages and inflames delicate lung tissue. This complication is called pneumonia, and it can be very serious. Each year, about 5.6 million Americans develop pneumonia, and about 60,000 people die from pneumonia. Worldwide, it's the single largest killer of children under age 5. Although these types of germs in your lungs are the most common cause of pneumonia, you can also develop pneumonia by inhaling food particles, vomit, or other foreign material. Not every death can be prevented, but quick recognition and proper treatment of pneumonia could undoubtedly save many lives. Anyone can be at risk for pneumonia or any other infectious diseases, but some are more vulnerable than others. Older people, young children, those with chronic conditions such as diabetes or lung disease, people who smoke, and people with weak immune systems are at highest risk. People in hospitals are prime targets, especially if they are critically ill, are on a ventilator, or confined to a bed for long periods of time. The cases of pneumonia that start in a hospital tend to be more severe and dangerous because the bacteria found in hospitals are often resistant to antibiotics. I hope this helps you understand what pneumonia is and who is at risk. If you have any questions at all, talk to a CVS pharmacist. We're here to help.
Treatment and prevention. It is recommended to start with an antibiotic and see if the patient is getting better. Prevention includes vaccination.
Vaccines are obviously one way to avoid getting sick. Here's a question about one specific vaccine that many of you may not know about. Take a look.
Hi, doctors. I have a question. Once I get the pneumonia vaccine, does it last forever? Or do I have to take it every year like the flu vaccine?
Well, it's not every year like the flu vaccine. Adults who are 65 or older, they actually only need to be vaccinated once in their lifetime unless they're at high risk for infection. Now, if you're at high risk of infection and if you were vaccinated before the age of 65, you may need to be revaccinated 5 years after that first dose. So, here's the reality. If you get a pneumonia, despite being vaccinated, there are a lot of different treatments out there, and a lot of people don't really understand what is pneumonia. I want to pull up some x-rays back here on the IMAX if I could. I'm going to walk back here and just show everyone really quickly what we're looking at. So if we could, can we pull up the normal x-ray? I want to show everyone the normal x-ray first. So these dark areas, these are the lung fields, okay? In the middle here, the white silhouette, that's the heart. These are nice, it's nice and black in here. I can see subtle lung markings. That is a normal chest x-ray. If I'm worried that you have pneumonia, you come to the ER, fever, productive cough, not getting better, weakness, fatigue, I'll order a chest x-ray and it may look like this. There are subtle clues. If you look at this from afar, you'll notice this haziness right here in the right lower lobe of this lung. Over here on the left side, this is the diaphragm. It's nice and clear. The borders of the heart are clear. But I'm looking over here and everything is obscured. What's happening in here? What causes a pneumonia? First off, it's the infection, often bacterial, but it can also be viral or fungal. Then the inflammatory cascade occurs. So what you're seeing in there is actually the airway gets filled with fluid, inflammation, white blood cells. And that's why people can have difficulty breathing, because sometimes pneumonia can just spread and spread. Treatment, it depends on. Is it a community-acquired pneumonia? Are you otherwise healthy? Was it acquired in a hospital? Because the bacteria that cause pneumonia, it can be different. And so we'll tailor your antibiotic regimen to what we suspect you may have. Sometimes we'll have you do an expectorant. But in the end, the key is we'll start you on an antibiotic, see if you're getting better. Usually, most pneumonias resolve without complication if you get someone on the right antibiotics. That's why if a cold lasts for weeks and then you develop fevers, worsening shortness of breath, worsening cough, every now and then a cold can turn into pneumonia. Go see your doc.
Yeah, sometimes we'll do with kids if I hear a pneumonia and they're not that sick, I'm not going to put them in the hospital, put them on antibiotics, and I tell parents to do what's called chest physical therapy, have them use their hand, and in the hospital they use a certain machine, but basically a cupped hand, and you just clap on the back, and what that does is kind of loosen all those secretions and helps the child cough them out. And that's one of the keys of pneumonia is to get that stuff out.
It's very true.
Presentation of case. Later, the patient reports exhaustion, fever of 38.9 degrees Celsius, cough with blood-thin sputum, pleuritic chest pain, dyspnea, and high blood pressure. The patient was treated with vancomycin and imipenem that are stronger drugs. The pros, we have that through bronchoscopy, bronchoalveolar lavage fluid was obtained from the lingual and right upper lobe. Associated with routine and fungal cultures were positive for B. dermatitis. A positive urine test for histoplasma and antigen is compatible with a diagnosis of blastomycosis. The cons. The progressive hypoxemia developed because of worsening volume overload. Anuria and hyperkalemia developed. The patient underwent cannulation for venous extracorporeal membrane oxygenation, and the patient died later that day. The conclusion. We have that the patient was infected by a fungi and had blastomycosis, and he was treated with antibiotics instead of an antifungal.